Hello everyone, and welcome back to the channel. Today, we're discussing some urgent health news coming out of Ethiopia. The Ministry of Health has officially confirmed an outbreak of hemorrhagic fever in Jinka town, which is in the South Ethiopia regional state. This is a developing situation, and we want to bring you the most accurate and up-to-date information available right now. According to a statement released this past Wednesday, health officials have identified 8 suspected cases so far. This is a serious concern, and the government is treating it as such. In response, a rapid response team has been immediately deployed to the area. Their mission is threefold. First, to determine the exact cause of this outbreak. Second, to conduct thorough laboratory testing on samples from the affected individuals. And third, and most importantly, to implement measures to prevent any further spread of the illness. So, what exactly is hemorrhagic fever? It's a term for a group of illnesses caused by several different families of viruses. These diseases are often severe and can affect many organ systems in the body. One of the hallmark signs, as the name suggests, is bleeding or hemorrhaging, which can happen internally or externally. However, it's crucial to understand that not every patient will show bleeding symptoms. Other common signs include high fever, fatigue, dizziness, muscle aches, and weakness. As the illness progresses, more severe symptoms can develop, such as vomiting, diarrhea, and in some cases, organ failure. The specific type of hemorrhagic fever in this Jinka outbreak has not yet been confirmed. This is a critical piece of the puzzle. Identifying the exact virus is essential because different viruses require different response strategies. For example, some hemorrhagic fevers like Ebola or Marburg are highly contagious and spread through direct contact with the bodily fluids of an infected person. Others might be transmitted through vectors like ticks or mosquitoes. Samples from the patients are currently being analyzed in a laboratory, and everyone is anxiously awaiting those results to understand what they are dealing with. In the meantime, the Ministry of Health isn't waiting. They're taking proactive and coordinated action on the ground. The official statement mentioned that the ministry, working alongside its partners, is carrying out surveillance and response activities. This isn't just happening at a high level, it's a community-wide effort. Health workers are intensifying their monitoring at the community level. This includes active contact tracing, which means identifying and monitoring anyone who has been in close contact with a suspected case. They are also conducting house-to-house case finding, a systematic approach to check on residents and identify anyone who might be sick but hasn't yet sought medical care. This is a vital strategy to contain an outbreak before it can gain momentum. The authorities have also issued clear guidance for the public. Residents in and around Jinka have been strongly advised to seek immediate medical attention if they experience any suspicious symptoms. The key symptoms to watch for are unexplained bleeding from any part of the body, a sudden high fever, persistent diarrhea, or vomiting. The ministry is stressing that early detection and treatment are crucial for improving patient outcomes and preventing transmission. Alongside this, there's a strong emphasis on public hygiene. Health officials are urging everyone to maintain strict hygiene practices. This includes one of the most effective measures we all learned during the pandemic: regular and thorough hand washing with soap and water. Additionally, people are being advised to avoid direct physical contact with anyone who is showing symptoms of the illness. These simple but powerful actions can significantly reduce the risk of transmission within the community. The response extends to the healthcare system as well. Health facilities across the entire region have been put on high alert. They've been instructed to strengthen their patient screening processes. This means that anyone visiting a clinic or hospital will be carefully checked for symptoms of hemorrhagic fever. Suspected cases are to be isolated immediately to prevent any potential spread within the healthcare setting. Hospitals and clinics are also required to promptly report any new suspected infections to the central health authorities, ensuring that the response team has a real-time picture of the situation. This is a testament to the importance of a robust public health system. The ability to quickly identify a threat, deploy a response team, and communicate effectively with the public is key to managing any outbreak. The collaboration between the Ministry of Health and its partners shows a unified front against this public health challenge. The situation is still evolving, and we are waiting for more information. The Ministry of Health has promised to provide further updates as soon as the laboratory results are available. Once the specific virus is identified, we can expect more targeted advice and interventions. We will be keeping a very close eye on this story and will bring you any new developments as soon as we get them. For now, our thoughts are with the people in Jinka and the surrounding areas, as well as with the dedicated health workers on the front lines who are working tirelessly to contain this outbreak. It is a reminder for all of us about the importance of global health security and supporting public health infrastructure everywhere. Thank you for tuning in to get this important update. If you found this information helpful, please give this video a thumbs up and consider subscribing to stay informed. Stay safe, and we'll see you in the next video.